If you or someone you know is planning on having foot and ankle surgery, there's certain things that you should think about prior to the surgery. It's really important to be proactive. This means not only knowing what procedure is going to be done, but what the recovery is going to be like. Are you going to be able to bear weight afterwards? Are you going to be in a cast or a walker boot or a post-operative shoe? And how long are you going to have to be off of your foot? These are all really important questions for you to ask your physician so that you can be well prepared. And what we're going to talk about in this video is some other ideas that you can think about to help improve your experience following foot and ankle surgery. In preparing your home for surgery, there's a few things that you should think about. The first is you want to move any objects that are going to make it difficult for you to get from one room to another. The second thing is, if your bed is normally on an upper floor, you should consider trying to move it down to a ground floor. That will make it easier. Third thing is about the bathroom. It's really important to make that safe, and that includes having a shower stool and putting in grab bars so that you can be safe when you shower. You want to stock up on supplies, particularly food. And you want to make sure that you have books, movies, and other things to keep you entertained as you recover. A lot of patients will find it helpful to set up a command post. This could be a bed or a couch where you will spend most of your time during the day. It'll be helpful to have things nearby like a telephone, a TV, and a computer, also a clock. It'll be important for you to have a way to elevate your foot. And this can be as simple as putting 1 or 2 pillows under your leg to keep it elevated to a level that's comfortable. Also at your command post, you'll want to have a table, ideally one that you can slide in and out that you can work on. As well, it'll be important for you to have a backrest or something that can support your back as you're sitting up. Many patients report that having a pen and paper nearby is helpful. Also, any handiwork that you might do, you should have that nearby. And finally, having some access to a drink, water, or some food, a snack would be important. So thinking about how you're going to be setting up your command posts can be very important as you recover from surgery. Ask your family and friends if they can help you during the recovery period. This ends up being quite important, even if it's just helping you with a meal or keeping you company. This is a time to get them involved. It's really important to think about your work and the activities that you like to do, and when realistically you'll be able to return to those activities. So obviously if you're undergoing a major surgery and you're going to be off your feet for many months, and you have a job where you have to stand on your feet all day, it's going to be quite some time before you can get back to the job. But even then, you want to have a sense in your mind of how long that's going to be. You also want to ask your work if they have an opportunity for you to work where you're not on your feet so that you can get back quicker. For individuals who do jobs where they're mostly sitting, they may be able to get back quite quickly. But it's hard to know what the recovery is going to be like, and things like just putting your foot down for a period of time can lead to increased pain and swelling. But nevertheless, it's helpful to talk to your physician and have a game plan in your mind as to how long you're going to be off from your work or the activities that you like to do as you recover from the surgery. Getting around after foot surgery is always a challenge, but it can be made a lot easier if you think about it beforehand and what's going to be entailed. So for example, if you're going to be walking with crutches because you can't put weight on your foot, it's helpful to practice with crutches ahead of time, including practicing going upstairs. Some people find it more comfortable to move around with a walker, and there's also some devices where they can rest their knee on and still move around that way. Those are called knee walkers. But however you're going to move around after surgery, you want to think about it and you want to practice it. It's important for you to think about driving after foot surgery. How long will it be before you're able to return to driving? It's often quite a while, especially if you're having your right foot operated on. And it's important for you to talk to your surgeon about realistically how long it will be before you're able to drive again. On the day of surgery and during your hospitalization, it'll be very helpful to have a sense of what will happen. Where do you need to go to check in? What's going to actually happen on the day of surgery? How long are you going to be in hospital? And what will happen to you during that time? For example, what will you use to control your pain? What will they be expecting on the first day after surgery? Will you be getting out of bed, moving around? Will you be working with a physical therapist? There's a series of questions like this that you can ask your surgeon and will help you as you recover. Going home from your surgery, whether it be the day of surgery or after a few days in hospital, is always a challenge. Moving and getting into a car, having your foot potentially down where it will swell and throb and be uncomfortable for you. So it's important to think this through. And it starts with knowing which day after surgery you're going to be going home. And then how is that going to work? Who's going to pick you up? What vehicle you're going to be in? And logistically, how are you going to get to your home and into your house? It's important that you talk to your surgeon about pain control post-operatively. Foot surgery does have the potential to be quite uncomfortable, but fortunately there's a number of modalities that can be used to successfully control your pain. And that starts right after the surgery, where during surgery you may have been given a nerve block to freeze the nerves that go down and supply your foot, and that usually can work very well, although it will wear off and then you will have some discomfort at that time. More commonly, people are treated with some type of narcotic medication, either orally or intravenously, and this can help control your pain but does need to be taken regularly and may have some side effects such as causing nausea or upsetting your stomach. It's important to have a clear strategy for controlling your pain when you're at home, and you should talk to your surgeon about your options. Generally, you'll be prescribed some medication to help with pain. This is often some type of a narcotic medication, and there may be an anti-inflammatory that's added to that. And it's important to take those medications as directed. You do have a couple other options to help manage your pain as well, and probably the most important of that is keeping your foot elevated. 10 or 12 inches above your heart is usually a good level. And this is important because when you put your foot down, even for a minute or two, the blood will rush to your leg and tend to cause swelling and discomfort. Another option is adding ice. If you can put a bag of frozen vegetables or some sort of cooling device on your foot for 10 or 15 minutes at a time, that can make a big difference in controlling your pain. A proactive approach to your surgery is important. I hope that you found this video helpful. I'd encourage you to go to our website, footeducation.com, and look at the checklist we've created so that you can be better prepared for your surgical experience.